What is consolidation therapy?
When we talk about myeloma therapy, I like to break it down into induction phase, consolidation phase, and then the maintenance phase. Induction's obviously designed to, optimize response, get the disease under control. Consolidation is just a way of further deepening the response, and by doing so, prolonging the remission. The most common form of consolidation therapy would be autologous stem cell transplantation, or high-dose melphalan supported by autologous stem cell transplantation. Outside of the transplant setting, consolidation therapy is used somewhat variably. If you have a patient who's been through initial induction therapy, absent of a transplant, and perhaps the depth of response is not what you wanted it to be, you may pursue several cycles of consolidation therapy to further deepen the response prior to moving on to maintenance therapy. And one scenario where that's frequently done is after stem cell transplant. So if the patient has had not as deep of a response to their transplant as you had expected, sometimes consolidation therapy after transplant will be applied for anywhere from 2 to 4 cycles, again to deepen response before maintenance therapy starts.
Consolidation therapy is something we stole from our leukemia colleagues. So if you look back in the history of the treatment of leukemia, what we found is you could give a big dose of chemotherapy, kill all the leukemia, people would go in remission, but they wouldn't stay in remission. So the only way to keep them in remission was by giving them repeated intensive chemo. So we stole that and said, okay, we don't need to do as much as that in terms of myeloma because we have the stem cell transplant, but we still think that giving some short bursts of intensive chemo can help, and that's what consolidation is. It's one of those philosophical questions in myeloma. When does consolidation end? When does maintenance begin? And we don't have a clear delineating factor, but generally we think of consolidation as a thing we do after the transplant. Once the patient's recovered from the toxicity of the transplant, maybe it's usually 6, 8 weeks, sometimes up to 2 or 3 months later, we'll give them a few cycles of consolidation. That's the other thing with consolidation. We think of it as not something that's going to last a year. It's 2 cycles, 4 cycles is generally consolidation. Usually consolidation, because it is still more intensive therapy, is 3 drug combinations. And right now in the United States, it tends to be Revlimid, Velcade, Decadron, or the KRD. So the Kyprolis, Carfilzomib, Revlimid, Dex are the most common consolidation regimens we use.
So consolidation therapy refers traditionally to a series of treatments that are given usually after a stem cell transplant in an attempt to further deepen the response after transplant. And this was initially done in some of the early transplant trials where patients would get a stem cell transplant and there might still be some residual disease. And so they might get another 2 or 3 cycles of combination therapy with 2 or 3 drugs in an attempt to further, again, deepen the remission. So that's what consolidation is. I think it's still controversial about when to use consolidation and who should get it. It tends to be used more commonly in Europe, where there were some randomized trials that suggested a benefit for consolidation after transplant. In the United States, there was a large randomized trial that didn't show a significant benefit of consolidation in the population studied, and so it's not used as much in some of the US centers. So I think this is still an area that's under investigation and something that can be decided on a case-by-case basis for each patient.